First of all, I want to thank our witnesses for being here. Clearly, you have shared very, very, very personal stories of pain. I often say that so often out of our pain comes our passion to do our purpose. Pain, passion, purpose. And so we thank you. You are here to remind us that the actions of drug companies and raising prices have real consequences for real people. Ms. Skipper, let me start with you. What is the most difficult choice you or your family members have had to make because of the price of a prescription drug? And then, just so you'll be prepared, Ms. Holt and Ms. Craig, I'm going to ask you the same question. Go ahead.
Thank you. I feel the most difficult thing was just keeping up with rent. We had to move around a lot, and my parents, it was either we paid the rent or me and my sister lived. As an adult now, I feel that I've made the sacrifice of really just enjoying my life. I'm 23 years old and I'm tired. And I don't want to be tired anymore, and I don't want anybody else to feel like how I feel. And I feel like it's unfair that not just only the 4 people under the age of 30 who died last month, but any and everyone who has been affected by rationing, that they didn't get to have that decent quality of life.
Yeah. Ms. McGlynn, I want to go to you with that same question. Ms. McGlynn, what has been the most difficult decisions you've had to make? Ms. McGlynn, you also said something that was so powerful when you talked about your son like a race against time. And one of the things that I've noticed is that NIH is a phenomenal place, and coming up with things that used to be fatal, they're coming up with solutions to make them chronic. And hopefully the things that are going on that you talked about will be helpful to your son. But go ahead. What's the most difficult decisions that you had to make with regard to your situation, ma'am?
Well, one difficult situation that I've had to face, a decision with Jordan, is actually a decision that was difficult, but also a decision that when he was diagnosed, I didn't even think I would be able to be in the position to have to make a decision. Jordan actually qualified for 2 clinical trials for similar drugs that are designed to do the same thing. And I actually had to make a decision at the last minute to choose one drug company over another because of the clinical trial design. And in one of the clinical trial designs, our boys were asked, a third of them, to be on a placebo for 96 weeks. And that's really hard when you know that what happens so quickly and at this age. Because like I said, at Jordan's age, we never thought he'd be doing the things he's doing. So if he were in a clinical trial right now receiving a placebo for 96 weeks, we know what happens. So we know what happens when these kids don't get treatment. So for me, that was, I mean, it's kind of a bittersweet thing to say. I mean, I never thought I'd be able to actually have clinical trials to choose for my son. So I'm extremely grateful for the innovation. But I also think, I know this isn't the purpose of this committee, but I do think that it's worth saying, since you asked me the question, that we also need to continue to rethink the clinical trial design for rare and fatal diseases as well.
Ms. Craig.
For me, probably one of the most difficult decisions is having to make the choice to go on affordable but pretty hard immunosuppressants. The current one I'm on that is affordable, I just got married. My husband and I have had to make the decision that I can't have kids if I'm on it. It's absolutely not allowed because it's an old chemo drug. That sucks, to be quite frank. I wish there were generic options for me. I don't mind paying for a drug, but it needs to be accessible and affordable. And I'm self-employed. I do well. There's no way anyone can afford $1,100 a month. And they just keep producing new biologics, which are even more expensive than the current ones on the market because there are no generics available. That's huge for somebody like me.
Thank you. And Ms. Holt.
I think the most difficult, or one of the most difficult things, was the induction therapy I needed, the chemotherapy I needed. I went to the drug counter, and my bill was over $4,000. I couldn't pay it. I was just shocked. So that was delayed 3 months until I came up with the cash in order to pay that to start my treatment. That was difficult. It was also really difficult to refinance my home. I'm thankful I had a home to refinance. Other people aren't that lucky. But to be that close to being debt-free and having to start over was very, very difficult for me.
Again, I have many, many more questions to ask, but I'm going to, my minutes are up. And so we'll now yield to Ms. Miller.